What I find in my practice is that it's fairly common for patients to get rigors and chills initially when we start the treatment with T-VEC for the first few injections. And this can be quite strong for some patients, that they really have quite a bit of a vigorous shaking and have a low-grade fever with this. If the patient develops that initially, we usually, on subsequent treatments, we pre-medicate them and give them Tylenol and give them acetaminophen, and also give them antihistamines. And that, in my experience, has decreased these rigors and chills for patients. Usually what we find is that by the time the patient has had about 5, 6, or 7 injections, those shakes and chills tend to go away. Now, as we continue the treatment, though, more long-term, and as we do repeated injections for this, patients can develop redness at the injection site. They can also develop a cellulitis. Now, many times it's not necessarily a bacterial cellulitis, it's just a lot of erythema at the injection site. Overall, though, the treatment is actually very well tolerated by patients, so very few grade 3 and grade 4 toxicities from this. If we look at milder toxicities outside of the pain, outside of the cellulitis and the injection comfort and the rigor and chills, patient can also have fatigue. Now, sometimes it is challenging to determine if that is just due to their disease burden, their melanoma that they have, or if that is due to the injection itself. But overall, extremely well tolerated by patients. In my practice, the majority of patients can continue their normal daily activities, they can continue working, and really do very well on the treatment.